So to talk a bit more about what they actually contain, one of the most well-used parts of the electronic health record is actually the time series. So these are parameters that change over time during the patient's stay. So these might be things like heart rate and blood pressure, and particularly if the person is in intensive care, they might well be on machines that are automatically logging these parameters. Then there are things that don't really change over time, or at least change very slowly. So these might be age, gender, and ethnicity. So we can consider these to be constant throughout the person's hospital stay. Diagnoses and medications are particularly interesting because they are very information dense. So what I mean is, if you tell a doctor a certain patient has this diagnosis and on these medications, that then tells that doctor a lot about the patient. But the difficult thing is for machine learning is that actually they're very sparse. So what I mean is that some diagnoses are common, things like diabetes, heart failure, and then there are many, many more diagnoses that are very rare. And the tricky thing for machine learning is for it to learn from a very small number of samples of particularly rare diagnoses. And what that means is they can't really use the information like a clinician would, because a clinician has been to medical school and they've sat exams on these rare conditions. So that's how they know, whereas you can't really send an AI to medical school. So it's very much an active area of research, and it's actually my other project is very focused on how to get the best out of this type of data that is difficult to work with. The next thing is lab results. So these are essentially time series as well, but they behave differently to the heart rate and blood pressure parameters because they tend to be monitored quite irregularly. So patients might have, say, a blood glucose taken once per day or maybe once every other day. Same with various blood tests. An example of a lab might be a coronavirus test, just to be topical. And these are harder to work with because for long periods of time, they just don't change. So it's particularly difficult if you ask a model to process labs and time series at the same time. And that's what we're doing in my project. So I'll talk a lot more about that later on. There's also information about where the patient is traveling within the hospital. And then there's some free text notes. This is a very interesting area of research because the text in electronic health records is notoriously difficult to process because it contains a lot of typos, mistakes, acronyms. Typically when doctors are recording information about their patients, they don't tend to stop and think, how can I write this in a very comprehensive way for researchers to use later? They're typically thinking, I've got a sick patient in bed 3, I'm just going to write as quickly as I can. And as long as another clinician can understand it, that's good enough. So that's quite a challenge as well. And then finally, there's imaging such as X-rays and MRI scans. And just to say that because the electronic health record contains such a wide range of different types of data, this is also a challenge in itself for machine learning, because how do you take all these different kinds of data together and actually get one representation that takes everything into account that's going to be a good representation of the patient? And this is something that humans can do naturally quite well. So clinicians can just look at all these different aspects and form an opinion about the entire patient, and that is very challenging for deep learning.